So you are a conventionally trained physician, and obviously you
Initially.
haven't
Fifth generation.
fifth, so it's in your blood. So how often do you use conventional hypnotics versus the approach that we're going to focus on? The integrated
So
approach?
I also had a long time in my earlier practice of treating addiction. So because of that experience and because I don't think they work very well, which is sort of paradoxical, I almost never use conventional sedative hypnotics.
Okay.
What they're good at is making a person unconscious. And most people find that the most dysphoric part of the insomnia, the laying there at night, not being able to sleep. And that, if you just treat that and you let that play itself out to its extreme, then you have Michael Jackson, who's convinced someone to give him an anesthetic at night so that he can be asleep.
Yeah.
But they disrupt stage 3 and stage 4 sleep, the benzodiazepines. The other non-benzodiazepines, the GABA-acting medications, tend to disrupt sleep latency as well, and they disrupt the quality of sleep. These just, at the end of the day, they're a Band-Aid. They're a shortcut. I think they're really only useful in very acute situations. Someone's died, you have to get through the funeral. You're taking your exams for your boards and you're just freaked out. You know, something that's very time limited, very unusual, really that you just can't learn mind-body stuff in quick enough to modify.
Okay. Yeah, good. So there is a role for them, like
There
with
is a role,
most.
there is a role, but it's chronically very abused.
Yeah.
And the other thing, the reason why I'm very resistant to start them is people tend to, it's one of those prescriptions that never gets looked at and taken off, like a PPI. And the problem with that is you can develop dependency, not frank addiction problems, but you can develop dependency, and it's a tough, tough detox.
Yeah.
A tough detox. And if you're older, you're increasing your risk for falls, you're disrupting your sleep quality even more. So I just find the negatives so far outweigh the benefits that I rarely go there.
Okay.